Okay, in this video, we are going to go over the answers from your in-class worksheet for Chapter 1. So this is designed for you to try to answer the questions on your own before watching this video, and this will give you a better, deeper learning experience and help you really learn how to apply the material. And the worksheet is available on D2L so that you can download and take notes. All right, so this is a case study. The emergency medical technician, or EMT, is on the way to the emergency room with a young victim of street violence. A knife with a 6-inch blade had been found next to the bleeding, unconscious man. We have a young male with multiple stab wounds. He has lost a lot of blood and we can barely get a blood pressure. The EMT radios to the triage nurse in the emergency room as the ambulance squeals through traffic. We started an IV and we are pouring in fluid as fast as we can. Where are the wounds? Asked the receiving nurse. He has a deep wound in his right upper quadrant just inferior to the diaphragm, replies the EMT. I can see bruising from the hub of the knife around the wound, and there is another wound in his anterior right thigh. His pulse is 120 and thready, which means weak. His blood pressure is 60/30. How long has he been down? Questions the nurse. Less than a half hour. We intubated him, which means inserted a breathing tube, and started a large bore IV as soon as we got there. We are 10 minutes out now. Keep the fluids going wide open, keep pressure on the thigh, and take him directly to Trauma Room 1, come the instructions. Meanwhile, the nurse orders the trauma team to Trauma Room 1, orders x-rays to be on standby in the room, and requests 4 units of type O negative whole blood, the universal donor blood from the blood bank. So question number 1. What organ or organs has likely been damaged by the knife wound to the right upper quadrant? So to answer this question, we need to first remember what our 4 quadrants are and where the right upper quadrant is. So we have this little diagram from the textbook. Then we need to remember where the organs in the abdominopelvic cavity are situated in relation to the quadrants. So again, we are looking at the upper right quadrant. So the answer would be most likely the liver was damaged and possibly a portion of the large intestines if we look at what organs are in this upper right quadrant. Question 2. The patient is lying on the stretcher in the ambulance in what anatomical position? To answer this question, we need to think about our 2 positions. Supine is lying on your back, prone is lying on your front. If the EMTs place the patient on a stretcher, chances are he is lying face up, so the answer would be the supine position. Question 3. What organ systems have likely been directly affected by this injury? Briefly describe how each system could be affected. So there are multiple possible answers for this one, and the purpose of this question is to get you thinking about the different systems, organ systems, and where they are located and what their functions are. So some possible answers include the integumentary system, which is composed of the skin. So we know the skin has been lacerated or cut by the knife in 2 places, one on the upper right quadrant and one on the thigh. We also could say the muscular system because the knife would have had to pass through muscles, so it would have cut through muscles in the body wall and the thigh. We could say the skeletal system. If the leg cut went deep enough, because it was a 6-inch knife, then the femur, which is the big bone in your upper leg, might be affected. We could also say the nervous system. Cuts by a knife would have severed or damaged nerves, and this would have caused intense pain. We could have also said the cardiovascular system. Severed and damaged blood vessels in the local area would cause blood loss. Or you could have said the digestive system. So there could have been damage to the liver and possibly the large intestines, and both organs belong to the digestive system. There are some other possible answers, so you may have chosen to answer some other ones. These are the ones that are most likely to have been directly affected, but there could have also been indirect effects. So the endocrine system could be involved to rebalance the fluid levels in the body, for example. If you have an answer that I didn't put on here and you want to discuss it, please bring it up in the D2L discussion boards. Number 4. The victim's blood pressure is 60/30, which is very low. Normal blood pressure is 120/80. What conclusions can we make based on his low blood pressure? So low blood pressure is usually due to a loss of blood. So the victim has lost a large amount of blood, and as the blood volume decreases, the blood pressure decreases because there is less fluid inside the vessels to maintain pressure. Question 5, how could this injury have affected homeostasis? Give specific examples. Again, there are multiple possible answers to this question. I'm going to cover a few of them. Feel free, if you come up with others, again, to bring them up in the D2L discussion boards. But some possible answers include, since blood regulates body temperature, a significant loss of blood could reduce the overall body temperature, so that would change and affect the thermoregulation and the normal body temp. A loss of blood would also disrupt the body's fluid balance. So when you lose blood, you lose a lot of water, and the body has a strict balance of fluid that it maintains as part of homeostasis. The normal homeostatic blood pressure of 120/80 has dropped below normal, so it's all the way down to 60/30, so that's a disruption in homeostasis. And then again, this is also due to blood loss. The loss of blood could also result in a disruption of the nutrient and ion concentrations of the body, so those are held at stable levels. And loss of blood could also reduce oxygen levels, since blood carries oxygen to tissues. So again, these are all things that your body likes to keep at a stable level, and this injury could have affected all of these areas. Moving along to question 6, this is a critical thinking question. How could a loss of body fluid volume through a loss of blood be counteracted to maintain homeostasis? Think of how a negative feedback loop could work. At this stage in your A&P education, you won't know about the specific receptors, control centers, and effectors, so think in general terms. So when we're thinking about homeostasis, and when we're thinking about this in general terms as early as we are in your A&P education, the key is to think about how negative feedback works. So with negative feedback, the response or the effect is opposite to the stimulus. And again, there are several possible answers here, and here are some of the ones that I wrote down. Feel free to discuss any others on D2L. For example, one possible answer would be that you've lost body fluids, so now you have too little water in your body. So that's the stimulus. The stimulus is too little water. And this could trigger a thirst response, and the thirst response would result in you drinking more water to replace the lost fluids. So again, the response is opposite to the stimulus. We have too little water, so our response is to cause the body to take in more water. Another possible answer is the loss of body fluids. Again, having too little water could trigger the kidneys to produce less urine. Making less urine means that the body could hold on to more fluid, and again, this is to counteract the water loss by keeping additional water in the body. Another example is that the loss of blood could trigger the production of more blood and more red blood cells. The production of additional blood would counteract the blood that was lost. So again, the stimulus was we lost blood. The response is we make more blood. So the response is opposite of the stimulus, and that is the basis of negative feedback. Question 7, if the deep knife wound had been superior to the diaphragm, what body cavity would the knife have entered, and what organ or organs could have been affected? So here's our picture again of the 4 quadrants. Remember that our injury was in the right upper quadrant, just below the diaphragm. So if we draw an arrow from that potential injury and we go straight above the diaphragm, then we land up here in the chest region. Then if we remember about our different body cavities and we're looking above the diaphragm, so that's where we would find the thoracic cavity. So the answer would be definitely we would be in the thoracic cavity, but since we're off to the side, we're more specifically probably hitting the right pleural cavity, which would affect the right lung. It's okay if you also said the pericardial cavity and affecting the heart. The key here was just to review your body cavities. Question number 8. It turns out that the large intestine was cut. Surgeons had to repair the damage to the large intestine, but they also performed a diverting colostomy, which created an opening from the large intestine through the abdominal wall to allow the large intestine to rest while healing. If the colostomy passed through the abdominal wall in the lower right quadrant, proximal to the level of injury, which of the following letters best represents where the colostomy exited the abdominal wall? This is not really the best use of proximal, but I threw it in here just so that we could review some of our terminology. All right, so first let's remember that our injury was up here in the upper right quadrant just below the diaphragm, so I added a blue X. All right, so our first clue is the colostomy is passing through the abdominal wall in the lower right quadrant. So if you identify the lower right quadrant on this picture, you will narrow down your choices to letter D or letter E. So now we need to look at the next clue, proximal to the level of injury. So proximal just means closest to. Normally it's closest to the attachment point of an appendage, but when you see it used in this type of situation, that it just means closest to. So read closest to the level of injury. So if we look at how far away D is and how far away E is, then it is obvious that the answer would be D because D is closest to the level of the injury. Question 9 says the cut to the large intestine means that the knife passed through two serous membranes. List these two membranes in the order that the knife would have cut through them. So we need to remember that in our abdominopelvic cavity, this is also called the peritoneal cavity. So we were talking about the membranes that are called the peritoneal membranes, or you can call them peritoneum. So remember that parietal peritoneum, so the parietal version of the membrane, is lining the cavity itself and is shown in this picture as a red line. Visceral peritoneum would be the membrane that is lining the organs and is shown as a blue line. So if we think about the knife puncturing through into the abdominal pelvic cavity, the answer is that first the knife will go through the parietal peritoneum because that's lining the cavity itself and is the first thing the knife would hit. And then secondly, the knife would go through the visceral peritoneum, which is outlining or lining the outside of the large intestine. The next question says classify each of the following as a sign or a symptom. So remember that signs are objective measurements that we can get with instruments, whereas symptoms are subjective and we can't really put a strict measurement on them. So a pulse of 120, that is definitely objective and measurable, so that would be a sign. Body temp of 36 degrees Celsius, again directly measurable with an instrument, that would be a sign. Blood pressure of 60/30, again this is an objective measurement, that would be a sign. Patient reports pain in the leg, so this is a subjective, I'm trying to not use the word symptom, but if you're reporting pain in the leg, that's something subjective. You can't really put a number on it or measure it. It can differ or be more intense from one person to the next. Even if you give the patient a pain scale, one person's 5 is going to be equivalent to another person's 8, so it's hard to really have an objective measurement. Therefore, that would be a symptom. Patient reports extreme fatigue. Again, this is very subjective and can differ from person to person, so that would be a symptom. Number 11, look at the x-ray below that was taken of the trauma patient and compare it to the normal x-ray on the right. So this is the trauma patient on the left, and on the right is a normal x-ray. Note the dark area under the diaphragm, and there's a black arrow pointing to this area. What could this dark area represent? Hint, think of the radiopacity of different substances. In which body cavity is this dark area located, and what type of sectional plane are we looking at? All right, so the first question, what could this dark area represent? Remember that dark areas usually represent air because the X-rays can pass directly through air, whereas more dense substances stop the X-rays and appear white on the X-ray film. So the answer to the first question would be darker areas represent air. Since this is air underneath the diaphragm, so we expect air above the diaphragm because that's where your lungs are. But since this air is under the diaphragm, this is usually an indication that the large intestine or small intestines in some cases have been cut, and then air from the inside of the intestines leaks out into the abdominal pelvic cavity. The second question, in which body cavity is this dark area located? For this question, we need to remember our body cavities. And again, we are under the diaphragm, which means that we are in the abdominal pelvic cavity. And then of the two cavities in the abdominal pelvic cavity, we are in the uppermost, most superior one. So the answer would be the abdominal cavity. And the last question, what type of sectional plane are we looking at? We need to remember our different cuts through the different planes. And in both of these images, we are looking at a cut that divides the anterior from the posterior. So the answer is that these are frontal or coronal sections. Number 12, the patient also had a cut on his anterior right thigh. What other anatomical term for thigh, or what is another anatomical term for thigh, was the cut on the front or the back of the thigh? So to answer this question, we need to remember the different terms that we have to learn in this chapter. And you can see that if I look at this image from the textbook, femoral is another answer for thigh, highlighted in red there. So the answer to the first question would be femoral. And the second question was the cut on the front or the back. We have to remember our directional terminology. And remember, it says anterior right thigh, and anterior is equivalent to ventral, and they both describe the front of the body, whereas the opposite would be posterior or dorsal, describing the back of the body. Since this says anterior, then his cut was on the front of the thigh. Question 13, fill in the blanks with directional terminology. The cut on the thigh would be located blank to the knee. So for this, we need to think about the entire leg. The leg is attached to the torso at the hip. So we are comparing the cut on the thigh, and I put an X here so you can see the cut on the thigh. We're comparing that to the knee. So which one is closer to the attachment point of the trunk? In this case, the cut on the thigh is closer, so we would say the cut on the thigh would be located proximal to the knee because it's located closer to the hip where the leg attaches. The next one, the cut on the thigh would be located blank to the stab wound on the abdomen. So if I put in a yellow X to represent the stab wound that was on the abdomen, now we are trying to decide between superior and inferior. And again, read the question carefully. It's saying the cut on the thigh is blank compared to the stab wound on the abdomen. Since the cut on the thigh is lower, the correct answer would be inferior. A great way to study, and I mentioned this in my study PowerPoint, is to see if you can formulate and answer possible test questions. In fact, a great idea is to make up a test question in any format and post it in the discussion board on D2L. I have separate topics set up for each unit and chapter of the semester. See how many of your classmates can answer it correctly. It will help you to come up with the question. It will help your classmates to practice answering questions. If you make this a study habit throughout the semester, it can really benefit not only you, but your classmates. Also, don't forget to review the end of the chapter questions. The ones that are recommended are on your objectives list. These could be very similar to some questions found on the exam, hint, hint, wink, wink. And that is it for the in-class activity for Chapter 1.